"Doctor, I am so excited to see you." I'm like, "Why?" "Because my previous doctor did not do weight loss. Do you believe in Ozempic?" Now, this is one of the most shocking conversations I ever had with a patient, because GLP-1 medications, of which Ozempic seems to be the poster child, has become some sort of a religious issue. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Melissa comes to see me as a new patient. As always, I ask, "How did you find us?" She's like, "Doctor, I am so excited to see you." I'm like, "Why?" "Because my previous doctor did not do weight loss. When I asked him that I wanted to lose 50 pounds, can you prescribe Ozempic for me? Guess what he told me? I don't believe in Ozempic or other medications for weight loss." I almost fell off my seat. And Melissa looked me straight in the eyes and asked me, "Doctor, do you believe in Ozempic?" Now, this is one of the most shocking conversations I ever had with a patient, because GLP-1 medications, of which Ozempic seems to be the poster child, and I tend to call them Ozempic because, that is what you and other patients call it. Because I guess it was the most popular, and not the first, but the most popular of the GLP-1 medications to hit the market, has become some sort of a religious issue. Now, when a physician tells you, "I do not believe in Ozempic," it transforms science into a matter of opinion, and that is where we do a disservice to patients. But I'll come back to that in a little bit. Before we get into that question, let's look a little bit at the science. Are GLP-1 medications like Ozempic or Mounjaro or exenatide and liraglutide a matter of opinion or science? The answer is a resounding yes, it is a matter of science, not opinion. Why? Because the data is very solid. Let's take the most popular ones. Mounjaro, also known as ZepBound, produces 15 to 20% of weight loss in patients studied in clinical trials after 72 weeks. Semaglutide, also known as Ozempic or Wegovy, produces 12 to 15% of weight loss in patients after 72 weeks. So the medicines are effective. Now, when it comes to side effects, we know the side effects of the medicines: nausea, vomiting, diarrhea, constipation. When it comes to black box warning, we know the black box warning. People who have acute pancreatitis, people who've had medullary thyroid cancer, people who've had multiple endocrine neoplasia 2A or 2B should not take the medicines. But you know what? This is common of all medications. If you've had angioedema, do not take lisinopril or losartan. This is common. So why would the physician say, "I do not believe in Ozempic"? Now, in my experience working with GLP-1 medications and thousands of patients, it always boils down to three things. Many studies have shown that only 15% of physicians actually understand the prescribing guidelines for these medications. Now, I know this is shocking, but I am not saying that only 15% of doctors have medical knowledge. Let's be clear. I'm saying that only 15% of patients in this study had an actual understanding of the prescribing guidelines for these medications. So to all of you, my fellow doctors, guys, let's get up to date with the current prescribing guidelines, okay? Now let's come back to another issue. The second problem is that there are many barriers to prescribing these medications. So when a doctor says, I do not believe in the medicines, he may just be using the wrong wording. Maybe what he's trying to say is that I do not have the staff to do a prior authorization. I do not have the time to work with you on weight loss, because the medicine is not just prescribed and the patient walks away. It requires monthly visits, coaching. It requires understanding the patient's system. How does the patient live? What other stressors are in the patient's life? What are the barriers to the patient accessing the medicine, getting them, and losing weight? It takes a lot of work. It takes a lot of emails. It takes a lot of patient phone calls. It takes a lot of angry messages from patients who A, did not get the medicine either because of the fault of the pharmacy, the insurance, or lack of financial resources. But you know who patients eventually blame? The doctor. And so many doctors shy away from these medications. But all of this leads to a big problem. 50% of eligible patients for GLP-1 medications like Ozempic or Mounjaro do not actually receive the medicine. That is a systemic failure that we as a healthcare system need to address. But this is where primary care and a doctor working hand in hand with the patient has the opportunity to shine. We have to create systems that allow patients to get their medications. We cannot tell a patient, I do not believe in Ozempic or Mounjaro. That is not scientific, and especially it's terrible patient care. You can lay the cards out to the patient. We need to do a prior authorization. It's going to cost $10, $15, $20, $25, $50 for the prior authorization. Why? Because we have to hire additional staff to do prior authorizations. Secondly, as a physician, I am your doctor. I am invested in you getting the medicines you need for the medical problems you have. So I am willing to do the work. I will call the insurance company. I will do the appeal. And I will document in my note that you absolutely need this medication, so you need to get it. Thirdly, I will open up my schedule and fit you in if you are willing to work with me for monthly visits where we review your progress, review your behavioral impediments. We review all the structural issues that impede you from achieving your goals. I will put the resources of my practice to benefit you in achieving optimal health care. That is what a physician-patient allyship should look like, and that is what we work on every single day. Until we achieve that goal, our work is not done. So as we wrap up, I want you to walk away with 3 important nuggets. The first one is, when you get face-to-face with your doctor, ask a direct question. I want to be prescribed a medicine to help me lose weight. Secondly, if your doctor says no, please feel free to get a second opinion. And thirdly, find obesity-trained doctors. Check out their websites and see if they are invested in helping patients lose weight. That is the crux of the matter. This note, I will see you next episode because the work is not done. We will keep on fighting for you. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.